But talking about all this, I want to bring us back to, we talked about big data. We talked about controversies in big data. We've talked about who owns the data. We talked about how we can share. How might big data harm patients? Gita, what do you think?
Sure. So first of all, it's not a silver bullet. So I think we've put a lot on big data, this idea that it's all out there. First of all, it's not all out there. Secondly, the accuracy of the data. We mentioned the data silos, right? So how accurate is the data? All of us as docs using EHRs, they're full of junk.
Garbage in equals garbage out.
Correct.
We've said that many times.
Correct.
Yeah.
And really fundamentally, this is big sensitive data, right? So someone's HIV status, mental health issues. If there is a security breach, we've seen it so many times in the industry, there are really serious ramifications for that individual, that person, that data has been exposed. So I think that, again, organizations that are dealing with this, which is everyone in the industry today, good governance, good protections, cybersecurity protections, very, very important. They really have to be the first step. And training, right? A lot of the clinical staff, you walk into any number of doctors' offices, there's a username and login for your PACS system, your EHR, your portal, and where's the username and password? On the sticky note, right on the computer.
Absolutely.
I agree and I disagree, as usual. I think that, yes, that's a concern. My HIV status, my LDL, that personal information that I don't want shared. But there's another domain that people consider just as personal, and that's their financial data, how much money I make, what I have in the bank. And that network is really seen as an extraordinarily secure network these days. So again, I see a duality there. At one hand, we say, oh, it's very fragile, it's data, we have to be careful. Yet fintech has done extraordinarily good jobs at securing financial information. Do I worry about my 401k data being released? I know that it's a more and complex data set, but I think that there's an interesting duality there, that I think financial data is largely considered to be quite secure and well managed. Why can't we do that with medicine?
I agree. I don't think we're there with healthcare. You think about how many hospitals have their EMR been hijacked with malware and they've had to pay a ransom to get their EMR back. What if you're a patient and a big, this happened at Blue Cross Blue Shield, their database got hacked. What if you're a patient and your employer or potential employer finds out that you have these 6 chronic diseases and they decide they don't want to hire you because you're going to be out all the time? And that's
or you're going to be expensive.
Or be expensive
what
to
about
the
if
group
you've been bankrupt?
cost?
If you declared bankruptcy 3 times? What about if you're a
No,
felon?
I'm not arguing that point. But
the issue is that we hide behind medicine as being, I don't know, if I have a criminal record, if I have driving, if I have bankruptcy issues, what would an employer do there? That may be as sensitive, if not more.
I agree, but I don't
hear it coming up.
I don't think the security in healthcare is near what it is in financial institutions.
There are lessons learned. There are lessons we can learn from the financial industry.
I think so.
Exactly.
I think so.
Exactly.
I think that the data set, how much money I have in the bank is X, but when we're looking at a complex clinical history over time, there's a lot of stuff that's much more sensitive. So I think it is a more difficult problem. But again, I think we should act like Picasso and steal.
All right, so this has been a great discussion. What I want to do now is go around the table and I want to get final thoughts, just a quick thought on what makes big data the most important thing or the least important thing on our list for innovation in healthcare today. We can start with John and we just go down the table.
Sure. I like Volvo as a car because their marketing is built around one word, and that's safety. I believe that the future will be built around, both societally and in medicine, around data, one word. That I think data will give us unique insights into connectivity between clinical data points that we never saw a relationship. I think it's going to be a game changer.
Gita?
So agree with everything John said. I would say big data is an opportunity. It's not a silver bullet. It's an opportunity for us to get more accurate information on our patients, deliver better healthcare, better, more accurate, precise medicine. Predictive analytics is a huge opportunity for us to actually predict when someone's about to get sepsis, someone is about to have a fall. So there's immense opportunity, but I don't think it's a silver bullet, and it has to be safe and secure. Period, end of story, or the story doesn't begin.
Love it. Dr. Albert.
Today, AI, our next topic, is at the peak of the Gartner hype cycle. And AI really translates in terms of the great strides we've seen in voice recognition, image recognition, into what are called deep neural networks. In order to train high-functioning deep neural networks, you need lots and lots of data. Big data is an absolute requirement, and it must be clean, accurate, and well labeled. And so in my mind and in my domain, and in the domains of radiology, cardiology, neurology, oncology, big data will give us the ability to train neural networks, which will give us the ability to develop predictive analytics. And in medicine, prediction means prevention.
I couldn't agree more. For me, the big data is all a big dichotomy because we're using big data, big population data sets to create personalized treatment and personalized care. So on the one side, we have the big data sets, and then we have the precise antibiotic that you need based on your DNA.